President, my name is Oluremi Tinubu, representing Lagos Central Senatorial District. I rise to move the motion on the need for increased funding to primary health care centers. And with me as co-sponsors are 106 senators that are my distinguished colleagues here. And I believe we all are in agreement that our primary health care centers, that we need to upgrade and also to make them more functional. So I will go straight to the motion. The Senate is aware that primary health care center is a grassroots community-based initiative that provides healthcare services to communities. Also aware that it is universally accepted that access to primary health care for all is only possible through prevalence and accessibility of primary health care. The Senate is reminded that primary health care in Nigeria was adopted in 1988 by the National Health Policy to provide promotive, preventive, curative, and rehabilitative services. Concerned that a lot of problems in Nigeria's health sector can be traced to low performance of our primary health care facilities. According to the World Health Organization, WHO, primary health care will meet 80 to 90% of persons' health needs over the course of their lives. We're further concerned as World Bank service delivery indicators survey shows that through available performance of the primary health care is hampered by lack of financial resources, infrastructure deficit, insufficiency or lack of drugs, equipment and vaccine, etc. The Senate notes that the primary health care has improved population health in low and middle income countries. It's saddened that, according to a journal published by Frontiers in Public Health, only 20% of the 30,000 primary health care centers in Nigeria are working, with most of them lacking capacity to provide essential health services. The Senate is worried that failure of primary health care and belief that it is for low-income earners has led to an influx of patients to the secondary and tertiary healthcare facilities. The Senate is further worried that our secondary and tertiary healthcare facilities are burdened with treating common ailments that could have been handled at a primary healthcare center. Concerned that the average Nigerian is one illness or tragedy away from poverty, is distressed to see an upsurge in pleas for crowdfunding via social media to enable access to healthcare facilities. The Senate is further distressed that Nigeria was only recently rated as one of the poorest in the world. Notes accordingly the need for comprehensive government-backed health insurance. Also notes that until accessible and affordable health cover is provided, emergency and non-emergency situations will remain a burden. Is reminded that health care accessibility is a fundamental right and must be treated as such. Senate, however, accordingly resolves to 1. Increase budgetary allocation for management of primary health care. 2. Urge the Ministry of Health to create awareness on the benefits of health and life insurance. 3. Direct the Ministry of Employment to put in place policies to ensure that every employer of labor has health insurance package for employees. 4. Direct the Ministry of Health to ensure that government-backed health insurance scheme is accessible. And 5. Urge the Ministry of Health at federal and state levels to encourage medical technological innovation in primary health facilities. Thank you, Mr. President, and my distinguished colleagues for supporting this, and I believe we're all in this together. I so move. Thank you, Mr. President.